JoCare from each corner of the country, south, north, east, west, even in Kigali. Hello, I'm called Shaddai. As you know, JoCare we discuss many things about sexually reproductive health, and today we have interesting topic called irregular menses, and we have a beautiful guest who is going to tell us more about that. Let me welcome her, and you are welcome in JoCare.
Thank you.
Yes, can you start by introducing yourself for our audience?
Hello everyone, my name is Dr.Munezero. I just graduated, so I'm getting used to that.
Sure.
Yeah.
Congratulations.
Thank you. I am commonly known as Dr. Ree by my colleagues and my classmates. So that's what I go by in most of the places. So I'm happy to be hosted here at JoCare as I discuss about a topic that's interesting to the world, but particularly to me because this is an area that I'm highly interested in. So I'm going to talk about irregular periods or menstruational periods and how it affects the fertility. So, yeah.
Wow, thank you. And I think you know that as you understand, you are blessed to have Dr. Lee. As she said, starting by Dr. Lee, why do they call you Dr. Lee?
So, Dr. Ree, how will I say? But Ree is from my name,
Okay.
Honorine.
Okay.
So the Ree in it, that's why it was derived from the R. Instead of RI, it became REE. So that's a short name because during my school, everywhere it was hard for them to pronounce my name.
Okay.
So we always thought for, some short nickname that will make things easy. So Ree is good, and I feel good about Ree, and yeah.
You are Lee, and also you are Munezero, as they can say that. Yes, that is, you have a good, beautiful smile.
Thank you.
So, Dr. Lee, me too, I'm going to say Dr. Lee, I think it is good for you,
Yes.
even for me. By engaging in our topic, you can start by told us what is menstruation and how when it become irregular.
Yeah, of course, for us to talk about irregularity, we have to know about regular.
Sure.
So this regularity is all about time. For the menstruation, as we all know, this is a monthly cycle where a woman who has passed puberty bleeds.
Okay.
And mostly it is monthly, 28 days, but then we take that from 25 days to 35 days is normal. In some circumstances, it also extends from 21 days to 45 days.
Okay.
So that's a normal cycle.
Okay.
That's a regular cycle. When you follow, let's say if your cycle takes 28 days, then every 28 days you have your menses. Then we'll call it regular. So the irregularity starts when it's no longer 28 days. Maybe it is 24, the other time it is 30. You see, it's still in the normal cycle, but then it's not the same every month. So that we call it irregular, regular.
Okay.
Yeah, that's the first step of understanding about the regularity and irregularity.
Okay.
And then it surpasses when it becomes more than those 45 days.
Okay.
Maybe you go in your menstruation every 45, 49 days, 60 days. Some people even get menstruation once in 3 months, 4 months. So that's when we say now that's irregular periods.
So it means that we say irregularity because of the interval.
Yes.
When you have the menstrual cycle of 28 today, and then in the next month you have a 20,
Yes.
the next one you have a 15,
Yes.
it becomes irregular.
Yes.
But when you have a 21, it is regular.
Yes, that would be regular.
Now we are going to know much more about that.
Yes.
So what is the cause, the common cause of the irregularity?
So maybe I will talk about this menstruation.
Okay.
The menstruation, for it to happen, we will have three factors.
Okay.
First of all, one that is involved is the brain,
Okay.
where the hormones are secreted and the messages are sent to other organs to secrete the hormones.
Okay.
And then the second part is the ovary that is gonna ovulate and release the egg.
Okay.
And the fourth part is the uterus. As we
Okay.
all know, the uterus is where we bleed from. That's when the uterus is, the line is thickened, then when it shades that, then that's the period.
Okay.
So when we say that someone is bleeding and not bleeding regularly, then there must be causes. The causes can be tackled in these three parts.
Okay.
If it is in the brain, then we may have hormones that are not being secreted right, or diseases that attack the hormones. We may have thyroid disease.
Okay.
We may also have the pituitary gland diseases, hyperplasia or hypoplasia, and then we may also have ovarian disease like polycystic ovarian syndrome. We may have also the uterine disease, where we may have abnormal bleeding due to the fibroids or any other anatomical problems of the uterus. So the other causes of the irregularity is the hormonal imbalance, where we have, because we have seen that the period is regulated by the hormones. So if we have imbalance, then it will be disturbed. Something that causes this hormonal imbalance may be diet, lifestyle changes. We may have obesity, and we may also have lack of exercises. Yes.
As you said, when you are going to look for the cause of irregularity, you start from the brain.
Yes.
That is where the hypothalamus and pituitary they are.
Yes.
They go to the ovary and also the uterus.
Yes.
If someone have irregularity, she may think that in those kind of three, maybe there is a cause.
Yes, because actually when you come to us at the hospital, we evaluate you according to these three things. We'll first of all, we take blood samples for those hormones. We see, are they regulated? After that, we may want to take to look at the uterus. Do we have any cancer going on that may cause these irregularities? If not, then can we go to the ovary? So these are the main three parts that we check.
So you said about thyroid, and someone may ask herself or himself, how is the thyroid related in the menses and the ovaries?
Yes, it is related because, as we know, also thyroid has hormones that work with the pituitary gland. So if these thyroid hormones are sending wrong messages to the pituitary gland, it also sends wrong messages to the ovary, which in turn gives the wrong hormones or irregularity in the hormone, imbalance in the hormones.
It means that they work together.
Yes.
Ah, wow. And the other cause you said about the lifestyle modification. My next question is on that kind of lifestyle modification. What are lifestyle which can affect the menses and become irregular, and how many people can address that?
So lifestyle changes are a lot. For example, we as young people mostly like to eat fast food.
Yes.
What does this all fast food do to us? They make us fat. And what does fat make us? Obese. And this obese may cause the hormonal imbalance, which will affect. The other lifestyle is exercises. I will talk about exercises because it may be the cause, but also it may also be the medication. Yeah, because for a lady who works out a lot and lifts maybe weight which is more than what they're supposed to lift, then that's going to cause hormonal imbalance.
Yes.
The other lifestyle is stress.
I'll
talk about too much work, too much study, too much of something that will deny you of your enough sleep. So this will also cause a lot of problems in your hormones.
Let's talk about stress.
Yes.
And there is something when they call, you know that some people, when they are on his marriage, on a marriage day, most of the guys, they usually take the party within them because they think that maybe they go to the menses in that.
Yes.
Is that true, or it is just a myth like any others?
It's true.
Sure.
Yes, I can't call it a myth because I have seen that. People report that because stress, actually our body is a whole and
Okay.
it communicates.
Yes.
So when you're stressed, remember we said the hypothalamus, the pituitary, all are located in the brain.
Yes.
So when you have stress, which is affects the brain, then it may affect the hypothalamus, that may make the hypothalamus to release the hormones immaturely or maturely. Yeah, so it's possible. I would say that that's possible for the irregularities to come because of the stress.
The stress hormone, cortisol, maybe play a big role in
Yes.
everything in our body.
Yes.
That is why everything you should know, just manage stress.
Yes, manage stress, but I want us to go well on the stress management because this is something that's not easy, you know, even for us. I'm
Okay.
sure there are times where we have burnouts and
Sure.
yeah, and it's just too much. And I think that's when we know, because our body talks to us actually, and I think that's the time you have to listen to your body. Am I tired? Am I too tired? What should I do? What do I always do to make myself relieve this stress?
Yes.
So stress is something that is subjective, 80% and 20% objective. So when it is subjective to you, then that's the time you know I have to take a step back and manage this stress so that I can keep going.
Okay. Dr. Lee, when you said about irregular menstruation, someone may think that it is normal. So my question is there any complication or any health implication which can be affect when that person who have irregular menses can face when he doesn't seek the health treatment? So if it is when people should think that I should go to the hospital because of my irregularity.
Thank you for that question. First of all, the time of seeking a doctor's help is anytime you think something is wrong.
Yes.
You know, we study that for, let's say, for a married couple that hasn't had a baby
Okay.
for 1 year, if they are below 35, they
Okay.
have to seek help after 12 months.
Okay.
And for a couple that's above 35 years, then they have to seek help after 6 months.
Yes.
But to me, I don't think that's the time because now we are talking about couples. So what about a female lady who is just 15 and her periods come once in a while and maybe once in 3 months, once in 4 months?
Yes.
They should seek help as soon as possible.
Okay.
Then the doctor is the one to know that your irregularity is not as severe. That's why I will give you diet changes, lifestyle changes, or it is severe and that's why we are going to start medication.
Yes.
So on the first point, we should seek help anytime you think something is wrong with your menses.
Yes. My question is when
When is
a girl or a woman can start saying, I must go to see a doctor? Because you said that it is irregularity of interval.
yes.
Maybe I can escape 1 month or 2 and come again. So when someone, individual, can think that the time is now, let me go to check.
The time is when you see the irregularities come.
Okay.
Let's say at the age of 25, you've been having regular or even regular irregular, where
Okay.
you have like 27 days, the other time is 29.
Okay.
That's within the normal range.
That is normal.
Yes. But then let's say today you have 49,
Okay.
the next you have 15,
Okay.
the next you have 60, then for 3 cycles you've checked, you have to see a doctor.
Okay.
Because for 3 cycles you've checked that they're not the same for
Okay.
3 cycles. For 2 cycles you may want to see the next 2 or 3, and then for 3-4 cycles, I advise you to see your doctor.
3 to 4 cycle?
Yes,
You can go
that
to
are
see a doctor.
irregular.
Is there any other symptom someone can track?
The other symptom is maybe other symptoms like mood changes.
Okay.
And also pain.
Okay.
Because irregularities, sometimes you may ovulate, but then you don't bleed.
Okay.
Because maybe there is an obstruction in your uterus.
Okay.
And by that time you have a lot of pain, but then without menses. Most
Okay.
of the ladies experience back pain and also stomach pain.
Okay.
So if you have these terrible pains, but then you're not having any flow, that may be an escorting symptom.
Okay.
You may also have severe mood changes, which
Okay.
may lead to depression. You feel so depressed, anxiety, or hyperactivity. That's also symptoms that may come with irregularities.
Also, those are kind of symptom of PCOS.
Yes.
The people may have the acne, the lots of hair.
Yes, yes, yes. Acne, hair, where we have facial hair like in females,
Okay.
whereas we should only have it in males. Yes.
So it means that when you think that you have some kind of that, you can go to seek the healthcare provider and he give you advice or treatment.
Yes.
Because if it is left untreated, it may lead to some kind of maybe dangerous, which is doctor is going to tell us the complication of the irregularity menses.
So for complications, as doctors, of course, we will always go for the most complicated. But yeah, fertility, and fertility.
Wow.
This is because
Oh,
when we ovulate
okay.
and there is no intercourse, so we expect not a pregnancy. We expect for a flow.
Yes.
So if we do not ovulate often, that means the fertility also, the chances are low. Because if a woman is ovulating once in 6 months, when they're supposed to ovulate every 28 days, the fertility rate is low.
Sure.
Yeah. So the other complications we may talk about, complications of the causes.
Yes.
Where we will have, like for the PCOS, we will have these hormonal imbalances,
Okay.
acne. We may also have pain,
Sure.
though that's chronic.
Yes.
We may also have abnormal uterine bleeding, where instead of periods you just bleed.
Breed.
Yeah, instead of menstrual periods, then you will have fresh bleeding. Yeah.
Stay there. Can someone differentiate the bleeding and the menses just by look?
I would say that the bleeding is, the blood is fresh.
Flesh blood.
Fresh, and it is red,
Okay.
bright red. Whereas for the menstrual periods, it's dark, and because remember it's a wall that's shedding, so it's kind of clots.
Okay.
Dark clots. So if you notice that the blood is bright red,
Okay.
then that might be a cause. And also for the bleeding, you may find that when you're having that bleeding, it fills the pad faster than the periods.
The quantity.
Yeah, the quantity is a lot.
It's just what we call menorrhagia or heavy bleeding.
Yeah, yes.
Okay. In that case, I think that you have those tumor in the uterus.
Yes.
The fibroids.
Yes.
Okay. What about the pelvic inflammatory disease?
Yes, pelvic inflammatory disease, they may also cause irregularities,
Okay.
in that they are affecting the pelvis, and we all know that for the pelvis, that's where our uterus and ovaries are located. So if there is inflammation at the ovary, then obviously it's not gonna be reproductive or be as active as it should be.
Okay.
So since it is also diseased, we may also get false results from it.
So it may be the cause of the uterine scar.
Yes, when we have a uterine scar and maybe we have a retained scar, we'll
Yes.
have more bleeding.
Okay.
And because the uterus may also think that there is something,
Okay.
and instead of bleeding, it will just cover it. Yeah.
Should I or should any individual have afraid of any cancer?
Cancer, as we all know, for women, we screen it and we think about it according to the age.
Okay.
Yeah. So you are a 21 years old female and there are some diseases that you shouldn't be thinking about because they are rarely according to the evidence. I'm not saying totally they can't happen, but then according to the evidence, the occurrence is low. But then if you're above 35, then that's why we even advise for pap smears where you may have endometrial biopsies to check if anything, so that we may check for all these cancers.
So it is good to seek for the medical attention when you think that you have irregularity, because as Dr. Ree said, there are many things which is behind that kind of irregularities.
Yes.
To be sure or to be safe,
Yes.
you can go to the nearest health center in order that you can be sure that there is nothing more than irregularity.
Yes.